If we change our metabolic health, we won't need to change the healthcare system. Everybody will be significantly more healthy. I mean, $1 trillion is spent on diabetes in our country. That's, and 90% of that is type 2 diabetes, which is a lifestyle condition, which means you are crushing your system, your metabolic system for decades. Oftentimes, although we're seeing, teenage diabetes, and it used to be called late onset diabetes. And now we're having teenagers and kids having diabetes. Like, that's how bad this has gotten. If you can incentivize people to take better care of their metabolic health, the costs go down substantially.
From Stanford to disrupting the healthcare industry, meet Andy Schoonover. He ditched a career at Google to build CrowdHealth, which is a business that's revolutionizing how we pay our medical bills. Discover the business strategy behind this bold move and why he decided to take on the insurance giants. This is one entrepreneur's journey you won't want to miss. Check it out. Andy, welcome to the show.
Yeah, thanks for having me.
This might be take two. Either way, we're gonna make this work.
We're gonna make it work.
But I wanna jump right into the original stepping stones or the issues or the challenges of starting CrowdHealth, because CrowdHealth is, in my opinion, a very, very revolutionary way of looking at dealing with the issues of healthcare costs. And I want to jump into all the things that we learned from this. But initially, I start with what were the initial things that got you into it, and then also what were some of the stumbling blocks?
Yeah, I wasn't really expecting to do another healthcare company, but I just felt like there was a need. There was a need here, and in essence, what happened was I was had kids, and for those who have kids, understand the Papa Bear mentality around your kids. Well, my little one was having recurring ear infections, which is awful. Again, if you're a parent, they're up all night, they're screaming. This is bad stuff, right? So we went to the ear, nose, and throat doctor, who said, "Oh, she's got a hole in her eardrum, and so she's got to get tubes in her ears." I'm like, okay, easy procedure, 15 minutes. So we went and did that. The ear, nose, and throat doctor was actually so worried about her long-term health that he delayed his vacation for a day to do this. And we're like, oh wow, okay. He's like, yeah, we need to get this done. So we went and did it. Got the bill, and it was $8,000. And I was just like, wow, $8,000, 15 minutes. That's crazy. I was like, this is what health insurance is for. This is the whole point. Little did I know, a few weeks later, the health insurance company was going to reach out and via snail mail, funny enough. And they said, medically unnecessary. And so they weren't going to pay for it. And so we went through 3 rounds of an appeals process. And at the end, they're like, no, it's not medically necessary. So I had to stroke an $8,000 check to the local hospital. And at that point, I was ticked. And so I called my health insurance plan. I was like, I'm out. If you're not going to pay my bills, I'm not going to pay your bills. And I was, at that point, uninsured. And so my wife kind of looked at me and was like, we're uninsured, what are we going to do? And so that, out of necessity, I had to figure out how do you really viably pay for healthcare bills without having health insurance? And so, we started doing all kinds. Little did I know I could have negotiated that $8,000 bill down. I probably could have negotiated it down to probably $2,000. Not only that, I probably could have gotten it done in a doctor's office for about $1,500. And so you start learning some of these things, and you're like, wow, how do we never hear about this stuff? Cash, if you pay in cash, it's way less expensive than if you get it through health insurance. So I was like, I bet you there's a company here. And as I kind of previously told you, I didn't think I was going to do another healthcare company, but it was you got something that you see so clearly that can work. It's like, let's do it. So started CrowdHealth in April of 2021.
And you were the first customer, I take it?
I was the first customer. Yeah. Me, my wife, and my two kids. Yeah. First customer. Our first real customer, funny enough, is still with us 3.5 years later.
Oh yeah.
Houston, Texas. Thank you out there for being, the first guy. So it was this one guy in Houston, and me, my wife, and my 2 kids. So, it was a pretty small group. If either one of us had a really big health bill, we would have been in trouble.
Do you,
the cold start problem, as they call it.
It's interesting how the healthcare industry, I've been saying this for a long time, is one of the only industries that's still a black box. In that you go, you get something done, whatever it is, and then a month later they send you a bill. And it's if you had brought that to any other industry, people would laugh in they would laugh in your face.
Yeah, absurd.
Right.
Yeah.
And so I've been hoping and wanting and dreaming of this like disruption of the healthcare industry for so long because of the sheer lack of transparency. And so it's cool to see somebody attacking this industry from that standpoint of like, we're literally not going to play the game of the black box, and we're going to find a different way to attack this problem. Do you know of any other companies or businesses that are attacking that same problem?
Not that I know of, not the way that we're doing it.
Yeah.
You know, I think there's some like health shares out there. People may be familiar with those, but these are these are groups of people who have some religious affiliation that they all get together and share each other. So like the Amish, for example, they all get together and pool their money and then they pay for each other. And there's actually organizations in Kenya, of all things, I kind of looked to them, and they do similar things. So they've got villages that will pool their money together in the village. And so literally, you know, neighbors pooling money. And if one of them has a healthcare event, then, you know, they'll use that pool of money to go and pay for that healthcare event. So there's some things that are similar, but mechanically we're very, very different from the way that they operate.
The first time I ever even heard of crowdsourcing, and it was such a revolutionary thing to me, was actually Peter Diamandis, if you know who that is. Mm-hmm. I remember him talking about that for just like certain like technologies or projects or businesses. It's just this idea of getting a bunch of people to pool together money for whatever your project is. But this is for sure the first time I ever heard it in the healthcare space.
Yeah, it's not something that has been around. I think we're trying to create a new category, which is a really hard thing to do. But we think that a new category has to get created because health insurance is terrible. I mean, United Healthcare, I was reading something the other day, they have an NPS score of like 4. You know, so to give you a sense of what NPS score, that's a net promoter score. You know, Chick-fil-A has like a 75 or 80 or something like that, which basically means, it's not exactly this way, but like 8 out of 10 people would refer, you know, tell a friend to go and visit. You know, for United Healthcare, it's 4 out of 100 people would say you should go with United Healthcare. So that's to give you some, you know, context for what that means. You know, and I think we're in the 80s for NPS score. So, you know, I was reading something by Andreessen Horowitz, which is a big venture capital firm on the West Coast, and their thesis is that the largest company in the world will end up being a healthcare company.
Just because of the GDP of how much money's in the company?
That's a part of it,
okay,
for sure. And this, basically what they were saying was United Healthcare and Apple need to have a baby. And that's ultimately what you do. But why are those two incapable of having a baby? Well, healthcare, if you think about it, is a B2B business. It's between health insurance companies and big hospital systems. So it's B2B. And so everything you get from that transaction, it looks like a B2B transaction. It looks like nothing you would find on your iPhone, like easy to use, customer friendly. No, it's the exact opposite. It's actually meant to confuse you so that the businesses can do their thing. I was out at Stanford for business school. My roommate was the number 2 in our class. I think I was like the bottom 20%. I called myself the bottom cum laude. But he was like number 2 in our class. And he's like, there's only 2 things that make me totally confused. This is one of the smartest people you ever meet. And he's like, property taxes, because you never know where they come up with that. They pull it out of their butt, right? Especially in Texas. It's terrible. And then health insurance, explanation of benefits. It's supposed to be an explanation of benefits. It doesn't explain jack shit. I mean, there's no explanation there. And a lot of times he's like, dude, the math doesn't even add up. Like this number plus this number does not equal that number. Like, how does this even work? Well, it's a business to business relationship. It's not supposed to work for you. You know, you're actually the product because you're not paying for it. You know, somebody else is paying for it. You're the product. So, you know, that's why it's so confusing.
How does it feel to go to war with big insurance companies? Like, those are $1 trillion businesses. Like,
yeah, I mean, it's like a tale as old as time, right? I mean, it's David versus Goliath.
That's literally what it is.
Yeah, it's David versus Goliath, and does everybody root for? Like David,
that's fair,
right? You know, and so I mean, like, look, I think somebody else told when I told him I was doing this. I'm in the process of writing a book. I was going to write a book with another guy who actually said, you know what, I'm not going to write the book because I feel like this is so inflammatory. What we are going to write is that I really truly believe, I'm scared for my life that some of these organizations will take me out. Like
Wow.
that's how how serious some people are about this. I'm not going that far. I don't think my life is at risk. And if my wife is listening to this, honey, my life is not at risk. But it is, they can take you down. I mean, they can take you out. I've lived pretty clean, so they don't have a ton on me. I have enough money so that if I fails, it doesn't really matter to me or my family. And so I think you need people like that who are kind of like, you know what, if it doesn't work, it doesn't work. If they try to accuse me of something, I got my wife, I got my kids, I got all I need. I don't really care. It's like, just don't give a shit, type of environment. And that's what it kind of is. Because the vast majority of people in healthcare are getting paid by one of those big medical industrial complex entities in some way, either the hospitals, the pharmaceutical companies, or the health insurance companies. And if so they go and start something and it fails, guess what? Like they're ripping on all three of these. They're not going to get a job with any of these. And so these three put food on a lot of tables. And so those people, it's very difficult for them to take a stand. You need somebody from outside who's willing to do this. And so that's where I kind of feel like, I am. And it's going to be an uphill battle, but especially if we're going to make this at scale, if this is going to work at scale, I mean, it's going to be a huge uphill battle because they got a lot of money, influence a lot of legislators. And so, it's going to be an interesting run.
It's going to be fun is what it's going to be.
It's going to be fun. Yeah, it'll be fun. If for nothing else, it's going to be a great story.
So just to give people context, can we maybe give people the elevator pitch of what CrowdHealth is, just so they understand even what we're talking about?
Yeah, healthcare costs. People ask me like, why are healthcare costs so expensive? And and everybody thinks it's so complex, but it's not. It's very, very simple. Hospital systems, who are the sellers of healthcare, they want the price to go up. Makes sense. That's an easy one to understand. Very few people understand that health insurance companies also want the price to go up. So they did something about 15 years ago, legislatively, Obamacare, called the medical loss ratio, which basically means that health insurance plans can only make a certain percentage of premiums as profit. So let's just do round numbers. If you have a premium of $1,000, health insurance plans can only make $150. And so how do they make more money?
Do you know why they set that rule in place?
Yeah. It's bureaucrats in DC thinking that it would be a great idea to keep health insurance plans from over profiting from your healthcare. They're like, we can't allow health insurance plans to make too much profit because that's bad for healthcare.
That's a really dumb way to look at it.
Stupid.
Yeah.
Absolutely dumb.
Like, I don't think there's anything wrong with profit if you're providing a lot of value, right?
Totally, 100%.
Like if you're keeping people healthy and from getting sick and you have really good outcomes, who cares how much profit they make?
Exactly.
Anyways, doesn't matter. But
so $1,000 premium, you make $150. How do you make 10% more? These are for-profit organizations. How do you make $165? Your premium has to go up by 10%, right? So over the long term, these organizations want the cost of healthcare to increase. So you have the buyers of healthcare, health insurance plans, sellers of healthcare, hospital systems, both wanting the price to go up. And so guess what? The price goes up. Right. And in between that, there's a ton of bureaucracy and administrative BS. Right. So tons of administration. Nobody wants the price to go out. There's no market forces. And so the prices will go up. So with CrowdHealth, what we're saying is, look, we want to introduce market forces into healthcare, and we want to rip out all the administrative stuff. One doctor takes about 15 and a half hours to deal with health insurance every week. So almost 2 days out of their 5 are dealt with health insurance plans. This is getting pre-authorizations, it's fighting about billing, and it's all the administrative tasks around that. In addition, each doctor has somewhere between 2 and 3 billing people that they employ to bill the health insurance plan. Okay, so this is just to bill health insurance. And I'm giving you this background. It's not a great elevator pitch, but I want to give the background so people understand what's going on here. And so what we're trying to do is saying, hey, we want you to actually be the customer, not the product. And so we want you to be able to go in and pay your doctor with a credit card or cash or whatever, so that you can rip out all the administrative costs. The doctor is going to give you a much lower price. You can go to whatever doctor you want now because that's a much lower price. And so you care about the cost because you're now paying directly for your healthcare expenses. We've introduced market forces. We've gotten rid of bureaucracy, right? And as a result of that, CrowdHealth is 50% less than your typical health insurance. So I'm taking the middleman out from between you and your doctor, and you're going to pay 50% less for your health care. I feel like that's a win-win-win. And so that's why we build CrowdHealth.
I've heard you say that you work for who pays you.
Yeah, you work for whoever pays you.
And I think that's a really good way to look at what you're doing. And if I was to like try to give my own like tagline or elevator pitch, I think it'd be something along the lines of like, do you want to work for your health insurance company or do you want to work for your buddy? You know what I mean? Because like ultimately, CrowdHealth is creating a friend community. It's a community. It's friends. It's your buddies. It's people you potentially know or have same life values or whatever it is. It's like, which one would you rather pay, right?
Or even different. I mean, if you're going into a doctor, your doctor is getting paid by the health insurance companies. They work for the health insurance companies, right? In the health insurance kind of scenario. If I go in and I pay my doctor, he's working for me now because I'm paying him directly. And all the other services, the doctor or the service provider has an incentive to provide me really good care because I'm paying you directly. He does not have an incentive to give me really good care if a third party is paying for it, right? And so that's the challenge that we have with health insurance is that we're not actually paying for any of these services. We don't know how much it costs. We don't care how much it costs. And the doctor is not working for us. They're working for, an insurance company. So when I say you work for whoever pays you, the doctor is working for your health insurance company. That doesn't seem like a really great doctor-patient relationship. And I can tell you, as somebody who now pays in cash for healthcare, the dynamic totally changes.
Totally.
I went into, because I had a little chest pain issue. It ended up being a pinched nerve, a nothing burger. But I went to a cardiologist and I walked in. I was like, hey, I'm cash pay. He's like, really? I'm like, yeah. He's like, great. I need you to do a stress echo test, but here's the best place to go get it because it's a really low cash rate. I think I got my stress echo test for like under $200. And by the way, they're going to send the results to me. If you were with insurance, I'd call you back in to go over the results. But since you're not, can I just give you a call? I'm like, hell yeah. You can, like, the last thing I want to do is take a half a day out of my life to come in and do all the paperwork again and sit in your office and all this kind of stuff. So it totally changes the relationship. And as we're getting more in this situation where doctors are loaded with patients, it's hard to get into some of these doctors, especially specialists. If you tell them I'm cash pay, I will pay you at the point of care. Who are they going to take, you or an insurance company? Somebody who works for the insurance company. They're going to take you because you're getting paid directly. They don't have to do all the craziness with insurance companies. So they love us. They love the cash pay patients.
I work with almost primarily, I would say, cash-based clients now. So I do marketing for health-related brands, and I would say most of them are like chiropractors or doctors or physical therapists, and almost all of them are cash-based for the most part. And I think there's a few things happening there. I actually had a really great conversation with a buddy, Jared Carter, probably be the episode before this one, but he was talking about how like you're actually seeing a huge shift in especially smaller practices of going cash-based.
Yeah.
And they're partly being forced to because like the big insurance or the big hospitals are buying up all the smaller clinics because they have power to be able to negotiate, to be able to get better rates on insurance reimbursements.
Yes.
And smaller clinics just straight up don't have any negotiating power because they don't have enough patients. And so they're forced to go cash based. And so at some point it's going to be like all cash based small private clinics, which is honestly where probably most people want to go anyways, because you're getting like actual real personal care as opposed to being in a giant networking system where you're just a number and nobody cares about you.
Totally. I mean, these independent docs are awesome.
Totally.
One is they typically are better because they can survive on their own. If they can't survive without a hospital system, it means something is going on. Right. That's not across the board, but a lot of times.
Totally.
If you're
an
independent
doc,
doc, and if you can get people to pay you in cash, guess what? You're probably better than other docs. And we're seeing that. So we try to get our people to independent docs all the time. The other thing is if you go to an independent doc, let's just say a primary care doc, and they do find out something wrong with you, and you need a specialist, they know other specialists in your area and they'll say, hey, this other guy over here is really great. He's not affiliated with the hospital systems. You should go to him. And by the way, that cost of doing business with that guy in cash is significantly less than doing it with a hospital system. We had a woman playing pickleball and tore her ACL. The hospital was going to do this procedure for $4,000 or $25,000. An independent doc did it for $11,000 or $12,000. And so like, and this is independent doc is a guy who does joints for the University of Texas Athletics. Like this is a good orthopedic surgeon. This is not, some bum who needs this business. He's like, he's good. And so, yeah, it's just better if you pay in cash.
Yeah. You're seeing that across the board.
And so we're trying to enable that. That's ultimately what we're trying to do, is we're trying to enable you to have cash so that you can pay at the point of care to these doctors, so that you're getting way better experience, way better quality, and a much lower price. So that's in essence what we're trying to do at CrowdHealth.
I can't wait to see, because I'm rooting for you, man. I can't wait to see what happens when CrowdHealth steals away, or really anybody steals away, all the like healthy people that are taking care of themselves and don't have these crazy medical bills. And then the insurance companies are stuck with the small percentage of people that have outrageous medical bills because they don't take care of themselves.
Yeah.
Like, what's their next move? Like,
well, and that's where I think it gets into a war, because they're gonna
Right.
be like, oh, these CrowdHealth guys are stealing all our healthy people. And I keep saying, like, look, if you're healthy, if you take care of yourself, if you watch what you eat, if you're in the gym 4, 5, 6 times a week, whatever it is, you shouldn't be paying as much for healthcare as the person who sits on the couch eating brownies all day long. Like, that is like fundamentally where I'm at. And so if you disagree with that, then that's fine, but we just have a different worldview. I should not be subsidizing those people. And so I should be paying less. And, CrowdHealth is just, so far, it's been primarily self-selecting, where we have a group of people who are incredibly healthy. Their BMI is like 5 points lower than the national average, or average age, I think, is, I haven't looked at it in probably 3 or 6 months, but it was 33 or 34 the last time I checked. And so our number one expense is pregnancies. It's just, we have people in their 30s, they're having babies. That's just is what it is. And I actually love doing that. Like, I bring more people into the world. I'm all for it. Second is active injuries. And so it's like people out doing stuff, right? And they hurt themselves. And, and I'm okay with paying for that too. You should be. Our biggest bill to date has been a guy, he was in Montana. He was in bear wolf country fishing at a lake or a stream. And he had a 44 in his holster. And so he caught a fish, he leaned down, the 44 fell out of his holster, hit a rock, shot him, went into his calf, out the back of his calf, into his thigh, out the top of his thigh, into his chest, and out the back.
My God.
So 6 holes, 1 bullet. He said he looked down and there was green stuff coming out of his chest, and he's like, I'm dead. And fortunately we got a helicopter in there to medevac him out. He was in sepsis. I think he was in a coma for like a week, almost a week. Got sepsis, so he was in the hospital for, I think, 4 to 6 weeks, something like that. I mean, this is $1 million worth of bills. And so, like, that just happens. Like, that's nothing he did. It was just like one of those, short end of the stick or whatever, scenarios where stuff happens. You get into a car accident, it happens. You tear your ACL playing pickleball, it happens. And like, I'm happy paying for that stuff because that's just life happens.
How long ago did that happen?
This summer.
Okay. So can we role play for a second here?
Yeah.
What would have happened had that occurred earlier on in CrowdHealth, when you literally just didn't have the manpower to deal with something like that?
Well, the great thing is that one of the things that we do is negotiate those bills. So we have a team of attorneys who will actually negotiate the bills on behalf of our members. And so that $1 million bill ultimately is somewhere like 200,000 or 300,000.
Whoa.
We were able to negotiate it down.
Oh my gosh.
And the other thing too is we knew it was going to be a big bill. Once you medevac somebody, like
Totally.
get a helicopter,
Yeah.
It gets expensive quick. And so we found out about it, I think it was July. And so we started funding that bill. We hadn't even gotten the bills yet. I think we funded like 100,000 in August, 100,000 in September, and 50,000 in October or something like that.
Yeah.
And so, again, we only got the bills in September. And so like we had already almost kind of funded it already, knowing that we were going to be able to negotiate it. And so it was a super easy bill for us to get taken care of.
That's wild.
Yeah. And he's like our biggest fan now. He's
I guarantee it.
yeah, because he's like, oh man, I accidentally shot myself. Is CrowdHealth really going to, help us with this? I was like, dude, of course we're going to help you with this. Like, this is, that was just like I said, a bad luck,
Talk to us more about some of the earlier days of CrowdHealth then. Like, how did you even get your initial members? Like, how have things kind of evolved? How
Yeah.
are things in the early days versus how they are now?
Yeah, man, I don't want on so many podcasts. And in real, what I was trying to do is saying, okay, who's this going to resonate with? And so I went on, everybody from on one side, I had, I can't remember exactly the name, but I think it was called Three Big Bad Bitches, which is like three transvestite women.
You were just going on everything.
Three men, women, whatever, who were just talking about the life as a transvestite.
Sure.
Right. And I was telling them about CrowdHealth, and they're like, oh, this is great. And they're like, that I got 0 customers.
Yeah, I'm sure.
On the other hand, I had like, Michael Malice. Do you know Michael Malice? He's like an anarchist. He's like no government, and nothing. Right. So he's like
Ayn Rand.
Yeah. And we actually got some people from him. I'm like, okay. And so in essence, what we found out is like people who have got a high desire for personal responsibility are the people who are joining. And so we end up getting lots of libertarians and anarchists and people like that who are like, I don't want companies. I don't want insurance companies. I don't want sure as hell don't want governments in the middle of my healthcare. And so, one deviation off that is like Bitcoiners. They're at the end of that, not quite as far as the anarchists, but they're out there. Decentralization. I'm a Bitcoiner, so it resonated with me, and maybe that's why they joined. Is because when I'm talking to the Bitcoin podcast, I got a little bit more like, this is what I'm about. One deviation away from that is like the low carb carnivore crowd, who are kind of contrarians in the way they think about food, because the government has screwed up our food pyramid so much. And I'm not a carnivore. I'm more keto, but I've gone through stages of life doing carnivore. So, it's just kind of, we're finding these groups of pockets of people who are like, yeah, I want that. And I don't want to subsidize vegans. I don't want the government involved. Those types of things. And so it just resonates with people. And so what I did is like, I got to find a niche and go deep. Because I've got to get a group of people on board quickly. And so we found a couple niches, and then we went all in on those niches. And, fortunately we got enough people to sign up really, really quickly. And, my customer acquisition cost at the beginning was nuts. I mean, it was dumb, but I had to, you had to get those people on. And then the customer acquisition costs over time have dropped significantly as you can really hone your message, find the people who are really interested in this. And then now we're at a point where more than 50% of our customers are coming from existing customers, which is awesome, right? Because they're telling their friends, I got to join CrowdHealth because it's so awesome. It's way better than health insurance. And so you start getting that, and that's when it starts to roll. I mean, I don't think Tesla has ever done advertising. It's all word of mouth. It's like, I had a Tesla back in 2014, which is funny enough. Funny story is Tesla, when you had a Tesla in 2014, Tesla owners waved at each other on the street. That's when I think I had the 1500th, Tesla S off the line or something like that. And we were like, hey, and so, but you never see an advertisement for that. You never see an advertisement for all these big companies who've gone, gangbusters. It's very, very rare that you see an advertisement. And if you do, you're like, that doesn't change, my desire to buy that, nor my desire not to buy that. Right. So,
what were you doing in terms of client acquisition? You mentioned podcasts. What else were you guys doing? That was it.
Podcasts. I mean, what we had to do is create trust that we were actually going to be able to get your bills paid. Now it's a lot easier because we have 10,000 customers. We've done 20,000 bills. I think 23,000 bills. We're up to $10 million worth of funding. And so we've kind of gotten to these places where people are starting to see, we have 300 reviews on Trustpilot, and they're all glowing. And so people are seeing that this is actually working. And so the risk of getting in is not nearly as high now as it was back then. So we had to steal some trust from the podcast host. You listen to, Dave Smith and Tom Woods and Eric Weinstein and all these guys who are our number 1, 2, 3 podcasters. They trust those guys. And so we're trying to steal some of the trust. And it has worked. And, they're our greatest customers now too. So we have, thousands of people from those 3 podcasts.
Have you ever had somebody just like massive donation, or people that just like, I want to just like donate a bunch of money because this has been so valuable to me, or just people that just like really support it? Or
We've had people offer not massive but bigger ones. So with the way that we work is I'm going to use a specific example to highlight what you're talking about. We have lots of women having lots of babies, and therefore, unfortunately, having miscarriages. It's just a part of the game, unfortunately. And so they have costs associated with that. And so inevitably, when we go out and we ask the community to help, we have women come back and are like, man, I know what that family is going through. I know the pain that they're going through. I know what she's feeling. Instead of the $100 a month, can I give $200 a month? Because that's the only way I can really help. And so we've had people who have said that, and it's recurring. It happens often. And so it's cool that like you would never in a million years, call United Healthcare and be like, hey, can I give you more this month? Like, of course you wouldn't do that. But since it's a peer-to-peer transaction, then it, does, again, a recurring, examples of this where people are like, I want to give more. I want to do more for this person, which is super cool, which means we're really building a community of people who are fighting for each other, even though they may never have met this person.
do you share the story of people that are asking for funding for whatever medical reason? Is that something that's up to the person that asked for the funding? And the reason I ask that is because I've become infatuated with the aspect of storytelling. I think it's how we connect, it's how we share information, it's how we understand ourselves. And I'd just be curious as to like, how much does that even come into this, right? Is because like if somebody sees, like you mentioned, the fisherman or birthing or just something that somebody resonates with, of course they're going to want to support that person more. It reminds me of like the saying, I'm going to butcher how it's actually said, but something along the lines of like, we'll do more for one than we will for many, essentially, is like when we see somebody struggling, we really want to support them. So I'm just curious how much
we need to do a better job of it. We do tell stories of our members who have big ones. So this guy, we're actually going to do a video of him. We're going to fly him back out to Montana, and he's going to be,
nice.
And we're calling it the big one, because it's that double entendre, like it's the big fish coming in, plus it's the big health event. So we do that. We need to be better at telling stories because there's so many good ones.
Yeah. Well, yeah. Cause like, I gotta imagine, like if it's the type of people I'm expecting it is, it's like mountain bike crashes, or like you mentioned, the pickleball one, or just things people resonate with. Right. And not to do it in like a manipulative way, but even just more in like a building a community way of like, obviously I support this person because we share values.
Yeah. Totally. And we need to do a better job of it. We did do it. We've done a couple of videos. We're going to do probably 4 or 5 more videos that are like 7 to 8 minute little mini documentaries of these people and what they went through. One of our first cool ones, just real quick, is we had a guy in Wisconsin who was working out, and his heart rate went up to like 220. And so he's like, crap, like what do I do? So he went to the hospital. He has a condition called supraventricular tachycardia, which basically means the electrical system within your heart is going crazy. And so the hospital was like, yeah, you have to have this procedure. It doesn't happen to happen now, but it needs to happen in the next couple of weeks. It's going to be $86,000. And so he calls us, and this is pretty early on. This is probably in the first 6 or 9 months. He's like, dude, guys, I'm so sorry. $86,000. You're like, look, can we find you another place potentially to do this? He's like, yeah, great. So we found a guy in Chicago who would do it for $44,000. So 90 miles away, we just reduced it by more than $40,000. We had a guy in Oklahoma City who would do it for $22,000. And he does more of these things than almost anybody else in the country. And so we called our member. He's like, look, you can go to Chicago. Members will take care of it. Or we'll give you first class tickets.
Totally.
We will, a CrowdHealth employee will meet you at the airport, be your concierge. We'll put you at the penthouse suite of the nicest place if you'll go to, and we'll compensate you for your time if you go to Oklahoma City. And he's like, sure.
Yeah, right.
Oklahoma City.
Easiest decision ever.
Yeah. So I think the entire bill for the Oklahoma City was something like 28 or 30 or something, all in. And so he still saved, $15,000 versus Chicago, and 50 some odd $1,000 with going to Wisconsin. And this guy thought he was the king. He's like, there's no way in hell United Healthcare would have done this for me. But for us, it made tons of sense because the community was going to save a bunch of money by him, traveling 1,000 miles. But that's how inefficient healthcare is. $86,000 in Wisconsin. Wisconsin is one of the most expensive places in the world to do healthcare. 22 or whatever it was, 22, 23, something like that, was in Oklahoma City. 1,000 miles away. I mean, it's nuts that's how inefficient our healthcare system is.
Are you familiar with I think they actually just went out of business, Forward?
Forward Health, yeah.
Yeah. Are you familiar with them at
A
all?
little bit.
I
I
just,
know they raised a bunch of money and then just went belly up.
yeah, which is so unfortunate because I don't know much about it, so I don't know the logistics of what exactly happened. But it just feels like another one of those companies in the healthcare space that I was hopeful for, because like I think the approach they were taking was more or less like concierge, direct primary care.
Yeah.
I think they were
In the box, right?
yeah.
Yeah.
And I think they were, again, trying to take insurance out of the game. And for whatever reason, who knows? I don't know why. But unfortunately, yeah, they went out of business. But it's just cool to see like a company like yours is to be able to show that there is proof of concept and that this can actually work under the right circumstances.
Yeah.
I actually saw too that you have like an even like subcategory of, I think it's like low carb or carnivore or something.
Low carb.
Where did that inspiration come from?
So I'm low carb, so it's a little bit of my, as the founder,
Here's
you
my
can
people.
you can kind of do whatever you want. And so I'm a low carb eater. And so, I was like, look, we should be able to compensate people for being better healthy, right? We talked about it earlier. And so, I want to actually give these people like a significant reduction in their monthly ask if they are actually metabolically healthy, hoping that we can incentivize others to be metabolically healthy. If we change our metabolic health, we won't need to change the healthcare system. Everybody will be significantly more healthy. I mean, $1 trillion is spent on diabetes in our country. That's, and 90% of that is type 2 diabetes, which is a lifestyle condition, which means you are crushing your system, your metabolic system for decades. Oftentimes, although we're seeing teenage diabetes, and it used to be called late onset diabetes, and now we're having teenagers and kids having diabetes. Like that's how bad this has gotten. If you can incentivize people to take better care of their metabolic health, the costs go down substantially, and we don't need to change our system. But that's just not going to happen. So what I wanted to do was incentivize people to get metabolically healthy. So to get into this community, you got to have a visceral fat level in the bottom 25%.
Which is what? Do you know what it is?
Which is less than a pound. I mean, it's usually like a half a pound of visceral fat, I think, something like that.
Cool. That's really low.
It's really low.
Because I actually literally just got a DEXA scan last week.
Yeah.
And I think it was like 250 grams, which I think is about a half a pound. And I'm pretty low. Like that's a pretty low number. I think
I was around 200
grams.
Yeah. I was not too far away.
Whoa. That's crazy low.
Yeah. It's low.
What's your body fat percentage?
The last time I checked that's not great. It's like 16 or something like that.
Okay.
15 or 16.
Mine was 13, which actually I thought was just higher than what I would have
Yeah,
thought.
it's genetic where you store your fat.
Yeah.
And so if you are not storing if you're storing your fat around your belly, it is not nearly as bad as the visceral fat, which is subcutaneous, which is hanging out around your organs. And that's where you're having huge issues. And so the fact that you are, very low in visceral fat, as am I, means that we're metabolically healthy. The other one we looked at is fasting insulin. And so you have to have a fasting insulin, I think under 5.5, maybe it's 6, but I think it's 5.5. And so one of those two things you have to be a part of this community. So in essence, what it is like, one, we're teaching you what visceral fat is, what fasting insulin is, what metabolic health is, and two, it's now we're giving you some metrics to aim for, right? What you don't measure doesn't improve, I think is the word, the lingo.
Peter Drucker, I think.
Something like that, yeah. And so we're trying to incentivize people to have better metabolic health. And if they do, they can save 20%, boom, right off the top, which, for a family is, let's say $150 a month, which is a pretty decent, chunk of cash for a family.
Do you know Jim Donnelly?
No, familiar name.
He started Restore, was his original.
Oh yes, I met him.
Yeah.
He's in town.
Yeah. Humanot's his next business.
Yeah. So I met him a number of times.
Yeah. Great guy. He was actually in the show recently, but he talking about Humanot, and that's where actually we went, my girlfriend and I, we went and got VO2 max test and the DEXA scan, and they have a whole bunch of really cool stuff there if nobody's ever checked it out. But anyways, where I was going with that is just like it's been fun to see like how these new companies are popping up trying to do the other end of the spectrum of how can we be more preventative, look at metabolic health. And it'd be interesting to think of like what would happen if, and I'm sure you guys could do this as well, is like, what if there was just like, this is step one of being a part of this community or this insurance plan or whatever, name your thing, of like, let's get a test. Let's get some tests. Let's get some DEXA. Let's get some VO2. Let's look at some like baseline metrics, lab work, whatever, name your thing. And how massive of an improvement that would do for people across the board, just knowing
what it is,
just knowing your baseline, just having any idea, like, let's just start there. And then there's no question there's going to be a handful of people that are like, oh, that's probably not very good. I should probably do something about that. Like, it's just interesting.
Well, CrowdHealth 2025, we're basically doing quarterly specials. And so the first quarter, you can go get a DEXA scan and it's fully fundable by the community. And so, and again, we're trying to do some education along with that. Quarter 2 is VO2 max. Quarter 3 is the coronary artery calcium score, which in essence is I think it's a CT scan that shows how much calcium, if any, is in your coronary arteries. And then Q4 is Lp(a), which is a lipid, but it's the genetic form of the genetic biomarker for cardiovascular disease. So this is not, we're not getting into LDL. This is not LDL, HDL battles, high-low, none of that. Don't worry about that. Lp(a) is another lipid that basically you can be super skinny and have a high Lp(a). And it's those people who are the triathletes who die of heart attacks because they've got a genetic predisposition to having coronary artery disease. Has nothing to do with your lifestyle. So we're trying to get people to understand that. You have to do it once. And once you do it once, you pretty much know where you're at. And then the fasting insulin on Q4 too. So you're getting those 2 lab tests. And so why are we doing this? Well, one is we want people to understand what it is. And most people have never gotten any of those. And so we're going to do it every year. So you're going to be able to see yourself improve as we go. DEXA scan, you're going to be able to see your, body mass, or muscle mass, visceral fat, so you can track it from year to year, which is kind of cool. And so we're trying to get some of those things so that people are educated about their bodies. They can take better care of it. They take better care of it. The prices will be lower. The costs will be lower. And the whole entire community benefits.
Man, this is exciting. I obviously we're getting a little into the health side of things.
Yeah, sorry.
No, it's fine.
Stick around business.
No, I know. I like nerding out on this stuff as well. Like I said, I get this stuff tested as well. Do you know your VO2? Did you get it tested recently?
Yeah, mine was 59, 58.
Wow. Man, you're savage.
Yeah, it was pretty good. It was better than I expected, actually.
That's like 1 percentile-ish.
Yeah,
like that's.
I didn't think I was going to go that high.
Damn.
We actually had a competition through the entire CrowdHealth ecosystem. All of our members had whoever did them. I think a couple hundred people went and did it.
Do you know the highest?
It was like 65 or something, 64. It was pretty good. It was pretty good.
Dude, I thought I'm pretty cardiovascular conditioned.
Yeah.
It was this like a 60 point something. And I was like, oh, that's pretty good. And then my buddy did it recently and he's like, I think he was like a 71.
Oh, wow.
And I was like, oh my God.
Yeah. That's like Lance Armstrong type stuff.
I wondered. I was like, are you doping? Like,
exactly.
That's pretty wild.
Yeah, that's awesome.
Anyways, back to CrowdHealth. So, okay. 10,000 members.
10,000 members.
Paid some major bills. Cool things ahead. Where do you see the future of this going? I mean, you mentioned this stuff, these new things where you're doing some of the smaller stuff of the DEXA scans and the VO2 and but from like a bigger picture, like zoomed out, like where do you see this going?
Yeah, I mean, I think community is a really important part of this. And we kind of mentioned it in some of the conversation we've had, but I think community is really, really important. And so what I'd really like to start doing is having communities, tightly knit communities who are funding each other's health bills. And so we're starting to do this currently. We mentioned the low carb group. We're calling it the carnivore group. It'll probably turn into CrowdHealth Metabolic next year because all the non-carnivores are being like, I'm not a carnivore. Can I be in? It probably wasn't the best name choice, but mistakes I've made. So the carnivore community will be, funding each other's healthcare expenses. We actually have a Bitcoin community that are funding each other's healthcare expenses. I think if you're in a tribe of people who are dependent upon one another, then there is behavior change, both in terms of how you take care of yourself. Because we've seen this. We had a guy who was like, he was like 60 pounds overweight to be a part of CrowdHealth because we have a weight limit. and he lost his 60 pounds over, I think it was like 9 months or something like that. And then he sent me a picture of him and his wife in a triathlon. And he's like, you guys motivated me to be a part of this. And I'm so excited that I'm now down to the weight that I need to be. And I'm still got some ways to go, but I'm going to get there. And I was like, man, that's amazing. So I think it does impact your lifestyle choices, being a part of a community. And as a result of that, I think the bills are going to be lower. Like, I think the bills for the low carb crowd, I'm biased because I'm a low carb, are going to be lower than other communities. And so if we can build communities like that are tightly knit yet big enough to fund the big bills, I think that would be really, really cool. And it could have a really big impact.
I mean, it's brilliant. It's going to help people stay accountable.
So yeah, you don't have like accountability partners, as a part of your tribe, right? And we all want to be a part of community. And so when I say that, people are stupid and they're like, oh, well, that's socialism. No, people, this is not socialism. This is not a government ordained, everybody puts in the same amount and we all get out nothing. Like, this is not socialism. This is community. Like, and there's nobody I'd prefer to be in community with than people that share my lifestyle choices, that are working out, 4 or 5 times a week, that are eating right, that are doing what they need to do. Would you prefer to be in the community with those people or the people who love brownies? I mean, that's the choice. And that's what we're talking about, is getting you in a community where you share some values with the people, and that's going to impact your utilization of healthcare expenses for sure.
If you would have said cookies, you would have insulted my girlfriend. She's an fiend for cookies, which ironically, her visceral fat was lower than mine. So
you guys are young. I got some years on you.
But I mean, not to get in the health stuff though, is like, I actually think I heard, was it you talking about this? I think it was you talking about this recently, about how, like, if you look at it from a financial standpoint, is like, if you're taking care of yourself the majority of the time, who cares? Have a cookie or whatever.
Dude, yeah, for sure.
You know what I mean? Like,
yeah, I'm not. I'm not,
I know you're just using an example.
I'm not dogmatic.
No, I know.
Philip Ovadia, which is a really, I fix hearts is I think his Twitter handle. He's a really good guy. He just did this great analogy for me, and I was talking to him about this healthcare stuff, and he's like, look, if you are poor, you have no business going to the nicest restaurant in town. If you are rich, then yeah, go to the nicest business, restaurant in town once in a while. No big deal. If you are metabolically unhealthy, you should not be going and having that bowl of ice cream.
100%.
If you are metabolically healthy,
go for it.
Then, I just had Thanksgiving. I had stuffing and I had pumpkin pie. Like, I'm not going to be dogmatic about it. I know people are. And if that's the way you want to live life, great. I enjoy some pumpkin pie.
Yeah. I had probably the best apple pie I've ever had in my life.
Yeah.
I rarely do desserts, but
I did pecan pie. Actually, I lied. I did pecan pie, which I don't really like, but I had this one. I was like, man, that's good.
Well, cool. So big future ahead, small niche communities. Is there any of the...
But I think we can get hundreds of thousands, if not millions of people to do this. Like, that's ultimately my goal. Like, what I want is most of us, 50% of us, maybe 60%, depending on the numbers, are getting our health insurance through our employer. What I would really like is to build something so great that they're like, I don't want, crappy insurance from my employer. I want to go to CrowdHealth because my buddy's in CrowdHealth and he's having a great time and it's his community and things like that. That's what I want to do, is pull people away from their employer's health insurance. And so that ultimately, I think, will crush employer-based health insurance, which I think is awful. I don't want my employer being involved in my health insurance. And so that's really what we're trying to do, is build a community, build a service that is like so great that you don't want this crappy health insurance from your employer.
And I think you will, especially with what you're mentioning of incentivizing some of the other, like, quote unquote fun things about being healthy, of like getting your VO2 or your DEXA or your any of these coronary tests. Honestly, it can be really fun because, like, you can see, like, oh, I've gotten better, I've gotten stronger, I've got better cardiovascular health. Is like, I think there is a fun side. I think we always just assume that healthcare is like only when you shoot yourself or some traumatic event. But I think, like, when you're looking at it from a preventative angle, is like, even when I recently got my lab work done, is like, it was fun to look at my numbers and to know where I'm at and where I can improve.
Sure.
Is like, you can gamify it in a lot of ways.
Yeah.
And I see CrowdHealth doing a lot of that. I'd be curious, have you had any of the big players come knocking at your door yet and giving you a hard time?
No, none of the big players, but we think some of the big players have told state regulatory agencies about us. And
saying what?
Saying that we're providing insurance. and we're not providing insurance. Like, it's so different. And so we've had multiple regulatory engagements. We've won every single one of them. So we're happy about that. It's cost several $100,000 to get through some of that stuff.
Really?
Yeah. So they try to kill you through, a bunch of cuts, like razor blade cuts. And so it hurts every time one of those agencies comes, but we've made it through it. And every time, it's really, the great thing for us is every time we get past one of those, the value of our company goes up, because I can go then to the next set of investors and say, look, we got this state, this state, this state, and this state have all said that we're good, and by the questions they ask, I know what they're looking for now. And so when I'm building my next version of CrowdHealth, which we're always iterating, I know what they're looking for. I know the way to structure the service. So I'm actually better off the next time they come and ask, because they've already asked all the questions once. And so it's helping me. It's not hurting me. And several $100,000 is not really what I want to spend, but it's worth the investment to get it right and to make sure that we're going to pass regulatory hurdles. And so far we have. So I think some of the big guys have kind of let the regulators know, because they got a lot of the state regulators in their pockets. And so that's kind of the beginning skirmishes, of the war to come.
This is classic anti-fragility, where like you only get stronger when they attack you.
Yeah, exactly. Yeah, exactly.
I love that.
Yeah.
So,
but really quick, back to the community, which I think is the fun stuff. And I hate to, this is little, but I think it's cool. The last 2 years, we've actually had CrowdHealth meetups. I know this sounds so dumb, but
I love it.
We were we were in Miami 2 years ago. We were in Nashville last year, and we had more than 100 people. It was like 125 people from CrowdHealth come just to hang out with us. Like, we got meat, and we got great food, and we got, great drinks. And we just hung out, which was a ton of fun. One guy drove from Orlando to Nashville, which I think is like 12 hours, hung out with us for 4 hours, and drove home. And we're like,
thanks,
this
man.
is amazing. So we're doing one in Vegas in May and Tampa in November this year. And we're just getting as many people who want to come can come, and we're going to throw a party. So, like, what healthcare company would you go and throw, would you show up to a United Healthcare party?
Not a chance.
That sounds like the worst thing.
Yeah, I don't want to hang with any of those people.
And so we actually do this, and it's a lot of fun, and people really enjoy it. So we try to do stuff like that too. That's just fun.
Well, something you alluded to on until it stopped recording, or I don't even know what happened exactly, but you mentioned that you got to spend time in the earlier days with Zuckerberg and hanging out with that crowd in that environment. And maybe there's a little flavor of that in you, with this like exclusivity of a community that'll grow into a bigger thing, right?
Maybe.
It's like, obviously it's a little different than a social platform, but maybe not even. Like, you know what I mean? Like, I see some parallels in the aspect of like the Facebook of like the early community building, kind of a niche community, like kind of this weird thing that nobody understands, could eventually be a lot bigger than that.
Yeah, I don't know. There's some, and somebody can do some psychological analysis on me, but there's a contrarian in me that thrives. And I think it does for a lot of entrepreneurs. Where does that come from? Is it getting picked on at the playground when you're a kid, or does it, come from whatever, like me being bottom cum laude at Stanford? Maybe, those types of things, but I don't know what it's from, but there's a contrarian nature in a lot of us entrepreneurs that I think we just want to change the way that the status quo is really, really boring. And so let's change it up. And as we kind of talked about, I'm not sure if you pre-recording or post-recording lost, but just this idea of being a missionary versus a mercenary, and I think the entrepreneurs that I like hanging out with are the missionaries who are just really in this to change the game, change the status quo for the better. It's a lot more fun that way.
What do you think your number one skill is as the CEO of this company?
Yeah, I ask people this a lot, like, what is your superpower?
Yeah.
And I think my superpower is coming up with very simple answers to very complex problems. Putting CrowdHealth together was very freaking complex. Trying to get through the regulatory and all this kind of stuff of healthcare is very, very complex. And what we've done is we put together like a very simple, easy to use alternative that's going to pass regulatory scrutiny. Like, that's my superpower, is coming up with something simple. A problem solver, coming up with a simple solution to a really complex problem. And we've been doing it over and over and over again for the last 4 years, and it's what I did in my previous company. And for whatever reason, I can come up with some it's not super intellectual and not super creative, but you hang out in between. Like I have friends who are wickedly intellectual, but have zero creativity. And I have people who are super creative who have zero IQ. But if you can hang out in the middle and pull from both sides of your brain, I think that's where some really special things happen. And most of my special things happen when I'm walking the dog, I'm in the shower, I'm hanging out with my wife, right after a workout. Like, it's amazing to me the ideas that just pop into your head right after a workout. And so one of the things too that my entrepreneurial journey, I think you've seen this on LinkedIn a little bit, is like, I don't work 80 hours a week. I work probably 45 in the office. I'm always thinking about the business, but I think you have to walk away from the business, release yourself from the day-to-day do, and do the think. And I think as entrepreneurs, especially CEOs, you have to be thinkers, not just doers. And if you're doing a lot, you have to do that early on. But if you keep doing a lot for a long period of time, it means you're not thinking. And that's what creates really great businesses and innovation. And so I see these guys doing 100 hours a week for, 5 or 7 years. And I'm just like, dudes, like, you're not giving your brain the ability to step outside and to really relax and come up with some of the most creative ideas. Because mine come out of left field. I'm like, holy crap, where did that come from? Right. And it's because you give your brain some time to just chill out and relax. And by the way, if you have kids, I have a wife and 2 kids, like if you're not paying attention to them, if you're not loving them well, all kinds of shit hits the fan. Like, and you're not as good of an entrepreneur if something's going awry with your family. Somebody posted something on LinkedIn, I think you responded to it. It was like the top 20 entrepreneurs of all time, right? And you go down the list, and it's people who have like trashed their marriages, trashed their family. It's like Bill Gates, who cheated on his wife, and his kids don't even talk to him anymore. I don't know. At least at one point that was the case. And so you're like, man, that's not worth it. It's not worth it. So anyway, that's my philosophy on entrepreneurship.
I agree, man. Like, it's I've written about this many times. For me, it's walking in silence or peace or in nature. If you look at so many of the greatest thinkers, of like the Steve Jobs to the Teddy Roosevelts to the Da Vinci, is like they were all avid walkers. Yeah. Is they created space. Like, they created amazing things, but they also created time alone to just wander and ruminate. And so you definitely need both of those. Yeah,
I think that's right. Like I said, I saw Steve Jobs walking multiple times down University Avenue in Palo Alto. That was his thing. He walked.
Did you ever talk to him?
I never talked to him. I wish I did.
Interesting. I have one last question. Before I ask that question, though, I just want to acknowledge what you're doing with CrowdHealth, man. I do. I honestly think it's like cool. I came from the healthcare industry. I used to practice as an occupational therapist, and I was in the industry for a while, and I hated it. I hated the corporate insurance-based system and culture and the way the entire system was built. And I ultimately decided to exit it for the most part because I just didn't want to deal with it. And so I acknowledge the fact that, like, I think it's cool that you've decided to attack it because most people have not. Yeah. So I think that's great.
Yeah, I appreciate that.
Yeah.
Yeah. Uphill battle, but it's a lot of fun.
Yeah. Last question. Yeah. It's whatever your best piece of advice is. So if you were to go back to the beginning of CrowdHealth or even your previous business, and you were to give advice to your younger self or somebody else in that circumstance of just like starting their business or getting into entrepreneurship, what would you tell them?
Yeah, I think I may have given away a couple of my ones that I think I would probably be in my top, being like, find a niche and then go deep into that niche. I think too many people want to be too many things, right? To too many people, like, meaning like, I want to build a service that will solve everybody's problems. And to me, that just doesn't win. I think you've got to find a niche who loves your product and then can be the people who go out there and exclaim it to the world. And so that's the thing I think you need to find. My first niche was, Bitcoiners. And then I've kind of moved into some other niches, but if you ask any Bitcoiner who should go for healthcare, they're going to say CrowdHealth. Like, it is what it is. And now 1/3 of our members are Bitcoiners. So go in the niche, go deep into that niche. And you've got to be, real too. Like, if you're trying to be a Bitcoiner and you're not, like, they're gonna know. If you try to be a carnivore person, but you're really not, or you're trying to be a whole integrative medicine guy and you're really not, then that's a challenge. So go into something that you love, go deep into that niche. I think that's the thing that most entrepreneurs don't think about up front.
Great advice.
And then the second one I would also say is like, to the extent that you can have time outside of work to relax, to do something that you love, that brings you joy, you need to do that, because I think your best thinking, your creative side, really relishes, that downtime.
Legitimate last question this time then. What is your thing?
What is my thing?
Yeah, what's your escapism?
For fun?
Yeah.
Fishing.
Oh.
Yeah.
Actually, I saw a photo of you with a massive bass.
Yeah. Fishing.
I saw a largemouth. You holding a largemouth that looked like a
Yeah,
shark.
like 8.5 pounds. That's not my biggest, but that was my biggest in Texas. I love fishing, and there's something about being on the water most of the time alone. I like to fish alone. I'm an introvert, shockingly, and just going after the chase. Right, it's back to the chase.
Yeah.
Of fishing. I just love doing that. So I grew up in the Midwest, where all my vacations were to the lake. I mean, I came with a kind of a lower middle class family. We went to the lake for vacations. That's what we did. We went fishing. That's just something that I've always loved to do. So my best thinking goes when I'm fishing. Better when I'm catching fish, not less as good when I'm not catching fish.
One of my favorite trips that I've done of all time is I did a solo camping trip up in, have you ever heard of the Boundary Waters?
Mm-mm.
It's in Minnesota. It's on the border
sure,
of
okay.
Canada. I didn't see anybody for days out there. And it was a solo fishing trip out there camping. And it was one of my favorite trips I've ever done.
That's awesome.
Yeah.
Another guy, John Mackey, who's in town also, John Mackey, Whole Foods guy.
Oh yeah,
the
yeah,
CEO
yeah.
of Whole Foods.
Yes.
I just went through the whole story, which is kind of his story of Whole Foods, which is really, really good if you're an entrepreneur and you're into healthcare. It's a really good read for people who want to read it. I think it came out earlier this year. And that's one of the things he did too. Some of his best ideas were, marching up the Appalachian Trail from Georgia to Maine. And he said, some of the ideas that he got from that came back refreshed, ready to go, and brought some really interesting, innovative stuff to Whole Foods as a result of walking. So highly recommend that.
Cool. Andy, thanks for being on the show. Appreciate it, man.
Yeah, man. Thanks for having me.